Hello, Terry. Hi, how are you? Who else is here with me? Sorry, I came on a little late trying to get my space set up, getting my props, and I had an intention for today, so I wanted to get something that I just got recently. That I wanted to use today. I mean, not that I got recently, but I want to use something today that I don't normally use, and I thought, oh no, I need to get it. It's a bolster. Who else is here? Terry, Sue. Sue, have you been with me before? Sorry if you haven't, I'm not remembering, but I'd like to know if you have been with me. Is it fall back? First time. Wow, I love that. Anything I need to know about your body, things you should or shouldn't do? Do you have any issues in your tissues? I have a total hip replacement, so things like that. It would be nice for me to know. And Terry, how are you doing? I hope you're doing well. Did I see you, Terry? I don't think I saw you on the Ask Me Anything this Tuesday where we talked about food. I don't think you were there, right? So want to know how you're doing as well. Love to check in and see. Thanks for the thumbs up already. Subscribe to my channel. If you're not subscribed already, please share with a friend. You know, there's a lot of people that watch these classes recorded. So I teach them live and it's not the ideal time for everyone. And so then people watch them recorded. If you do get a lot of advertisements on YouTube, you could actually pay to have I don't know if you get, I guess you get no commercials. So I know that that's an option. And some people have done that because it can be really annoying when there's a lot of commercials, I know. Okay, osteoporosis. Have you practiced yoga before? I'd love to know that. Today will be a really good class, actually, Sue. I'm glad you're here because I'm going to do a lot of awareness today, a lot of safe movement awareness in the practice. That's what I had planned today. So it's going to be perfect for you because that's really important. Okay, great. Well, Terry, you can watch that. So you're in the community. And when you're in my community, Stronger Bones Lifestyle community, that's where I post and host a lot of valuable information to help support women with their bone health. And I have live calls that get recorded in there. I have live workshops, master classes. And so my Ask Me Anythings that happen twice a month, we just spoke about food, what to feed your beautiful bones. What should you eat for osteoporosis or for bone health? Because that becomes a really important topic and it matters. What you eat matters. What you eat directly and indirectly affects your bone health. And knowing what you need to eat and what you shouldn't eat is really important. So the Stronger Bones Lifestyle community, I teach cooking classes in there. Each month I teach a cooking class. You can come in and observe a class. And then when you're in the community, you actually get to watch all the replays and get a lot of support materials depending on what the topic is. You've never done yoga. Okay, Sue. Well, that's great. I'm glad because there'll be a lot of instruction today on what you need to do to stay safe when you're practicing yoga for bone health. So that's perfect. Glad to have you here. All right. This practice today, we're going to focus on some of the most important areas when it comes to our bone health. So falling and fracturing a pelvis or a hip actually statistically can be deadly, right? 20% of those that fall, that fracture a hip die. The other 20 to 40%, maybe in between the 40 to 50% range, you don't gain back your independence. So it's really, really important for us to focus on fall and fracture prevention. One thing I want to say, though, that I think is really important when we talk about that is that it's a certain person that falls and has those really horrible statistics. It's usually a very fragile, frail, 80-plus-year-old female with multiple conditions, multiple metabolic conditions. It's not an active female, regardless of age, that is the one that will fall and have life-altering complications from that fall. So that's important for me to have you know, because when you're practicing yoga, when you're doing all that you can for your bone health, that's not you that is in that category of statistics. You are in the other category. Maybe you fall, maybe you fracture, or more than likely you will avoid fractures. And that's what I see that happens. So in the practice today, we're going to focus a lot on the hip complex area, because this is the area that is really precarious to fracture. And we can strengthen the muscles that support this. We can work on creating the flexibility and range of motion in the joints so that we have more ability in our body to withstand a fracture. So becoming bendable and not breakable is what I like to say we call that. So I'd like you to get some things for today's practice. Having a blanket, a block, and a strap is important. So get a blanket, block, and a strap. You're going to need that. I like to start with the mind-body connection. So we will begin on the ground for the practice. I have a yoga bolster, and I know not everybody has a yoga bolster, but you do have access to pillows. You could actually use a towel or a blanket and fold it up to make it like a bolster. So go ahead and gather some of your towels, blankets, whatever it is you need. We're going to use this bolster today. It's going to help with some of the movements that we do in the practice. And props are really a great way to stay safe in the practice when we're practicing. A chair is something we will lead to today as well. And if balance is an issue, I recommend that you practice near a wall, because that can be really supportive in your body. So practicing near a wall, get a chair. If you don't have a yoga bolster, which I know many do not, then get some towels, blankets, or pillows. And if you get the pillows, like the pillows we use on a sofa that are a little bit more firm, that may be a little bit better. So go ahead and grab whatever it is you need for the practice today. So one of the most important things when we're practicing yoga, and especially if we do have a diagnosis of osteoporosis, or we have other conditions in our body that we need to manage or pay attention to, it's really important that we are in the moment, that we increase our body awareness. It's called interoception, this inner knowing of our body. And so the beginning of the practice today, we're going to come into a place where we connect the mind and the body. We come to this present moment so we can be very in tune with our body, so that when we start moving through the practice, pushing, pulling, creating stress and forces that are going to build stronger muscles and in turn build stronger bones, that we are in this place of connection to make sure we could be the safest possible and create the most stimulation possible to our muscles, to our bones, to our joints, creating strong, flexible, healthy joints for healthy aging and for bone health. Really important. So put your blanket at the top of your mat. Blanket at the top of your mat. And then we're going to put something underneath our knees, because this will help to relax your pelvis. And we're going to do a lot of work today with our pelvis. So I want to get a lot of pelvic awareness here and start off by taking any extra tension out of our pelvic area. So the bolster or rolled up blankets or pillows is going to go underneath your knees. I'd like you to come down to the floor before you do that. So before you put it underneath your knees, I don't want you to roll down like this, because if you're doing this in a collapsed position in the front of your body, that's not healthy for our spine. So I'd like you to come to the side without thinking of this underneath your knees yet. Take your arm long. When you take your arm long to lower down, you're keeping your spine nice and long, and that's really important for spinal health. Then bring yourself all the way down onto the ground, and from here you can range yourself. So the blanket goes underneath the head only. So if your blanket is underneath your shoulder area, pull it up so it's only underneath your head or neck. And then the bolster is going to go underneath your knees, and your heels are going to touch the floor. So let the heels touch the floor here. Arrange yourself in a nice aligned position by pressing your arms into the floor and your head into the floor so you can lift your rib cage up, slide your shoulder blades towards each other. Then take your legs a little wider than your hip joint or than your body. So your legs are wider than your body. And then let's take the arms out to the side. So when the arms come out to the side, I want you to pay attention. Do you notice any stretching on your body, right around the shoulder joint area, right where the arms attach to the body, where the chest is? Do you notice anything there? You can keep your eyes open at first. Lift your head, lengthen your neck so your back neck is nice and long. And then the arms are out to the side. And if you start to bend the elbows a little or raise the arms up towards the back wall, that will start to give you a little bit more potential for stretching your shoulder and chest area. So see if you could get yourself into a place where you feel something happening here in the posture muscles, the chest muscles, the shoulder muscles. Take your arms out to the side, lift your head, lengthen your back neck. Feel this, notice how you are feeling in this position here. And then close your eyes, bring your awareness to your body here, and just do a little tapping with your heels to feel the heels on the ground. And with the eyes closed, when you do tap, what happens? Do you notice anything happening in your pelvic area, low back area? And then go ahead and let the legs soften, let the legs be heavy. Feel the weight of the heels, the weight of the legs on the bolster. Just feeling this in your body. We're going to bring a little bit of movement into the neck, shoulder area. Take an inhale. And as you exhale, let your head move in one direction. And then inhale, bring yourself back up to center. Exhale, let your head go in the other direction. And inhale to bring yourself back up to neutral. Exhale into the stretch. Inhale back up to neutral. Exhale into the stretch. And inhale back up to neutral. Exhale and inhale back up. Go slow, feel and notice whatever it is you notice. Posture plays a critical role in bone health, and head position throughout the day matters for spinal health and actually for keeping yourself upright. So this postural awareness aspect is really important. And we're moving the head side to side. We are stretching the upper back and neck muscles that are supporting posture, side to side. And then bring your head back up to center. Take your arm bones and see if you could slide your arms a little higher towards the wall behind you. The important thing here is that the back of the hands is on the floor. The wrists are moving towards the floor, so they may not touch completely, but try to get your wrists to touch the floor, backs of the arms and the back of the hands. The way you could get this to happen is move your hands farther away from your body. And if it's a lot of tension in your shoulders, you could lower your arm bones to take some of the tension out. So you feel your way into what feels like the appropriate pressure and stress. This is a factor of posture. It depends on what's happening with your thoracic spine, the spine that's attached to your rib cage, how much tightness exists in your shoulder area or with your chest muscles, your pectoral muscles. So do whatever position you need to be in, find whatever position to create enough of a stretch, but not too much. And then if your low back is not happy, push your belly button strongly towards your spine and try to push the low back towards the ground. That's going to activate the core muscles, which help to support the low back. The core is the front of the back. So protect your back. And then slow, deep breaths, breathing in through your nose, out your nose. Keep your mouth closed. In and out your nose with your breath. Noticing the breath at the nostrils.
And then I'd like you to bring the hands one at a time. So bring the left hand onto the belly and bring the right hand onto the belly. Noticing as you move, as you take yourself out of that stretch in the posture muscles, how your body feels when you do that. Take your hands on your belly, below your ribs, onto your belly, and then spread your palms. Breathing down to your belly. Deep breaths all the way down to your belly. And feel your belly rise. The goal is to get your belly to move. When your belly moves, that means you're breathing very deep and you're stimulating the diaphragm, the primary breathing muscle. You're doing a proper deep belly breath. Finishing the breath you're on, take 3 more breaths to your belly, to the palms on your belly. Feel them move. Feel your belly pressing into your palms, pressing into your fingers. Take your last breath here. And give the breath back to your body to breathe itself. Start to bring movement into your fingers and into your toes. Wiggling your fingers, wiggling your toes. And then with whatever's underneath your legs, if you push into that, your feet will come off the floor. Strongly point your feet as you inhale. As you exhale, reach through the heels, pull the toes towards you. Pointing and flexing. Point and flex. And then go ahead and release. So you're gonna bend your knees. Put your feet on top of whatever it is you have underneath your body, just to get a little relief of the low back. When we are correcting posture, whenever we're correcting posture, especially in the middle spine, the 2 places that the tension will go to maybe is the lower spine and the low back, or in the neck and the upper spine. So giving yourself a little break here. If you elevate your feet, whether you put them on a bolster, you put them on a chair if you had a chair here, or even doing legs up the wall can be nice and relieving for the low back. And it really helps to settle the pelvis and the hips. So let's take the bolster out from under and go ahead and push that off away from you to the side somewhere. Okay. So let's do a hip warm-up sequence. We're going to do this on the ground in a supine position. Have a blanket behind you. Coming down, we're going to come down actually through a rolling up position. So walk back and forth or rock back and forth side to side so you feel your sits bones. So getting familiar with your pelvis, the bottom bones of the pelvis are rounded. So moving side to side, I want you to feel that. And then I want you to move forward and back. Forward and back. So I'd like it to be more of a pelvic movement if you can. I want this bend to be happening in your hip joint as you go forward and you go back. You could hold on behind your thighs or you could hold on to your shins. What you want to pay attention to is that you do not round your spine. So don't round your spine. Sit nice and tall here. That'll distribute the weight right down the center to the center of the buttock bones. The side to side movement to feel them. And then front and back. Moving front and back, you're actually moving in the hip joint here, going front and back. Just notice here the muscles that are involved in this action. You're going to feel the low back stretch when you come forward. And when you go back, you might feel the work of the hip flexors depending on how far back you go. So forward and back, getting familiar with your hip joint and how it moves, and isolating that movement separate from the spinal movement. So if you have osteoporosis especially, and if you have osteopenia, but especially with osteoporosis, we want to really pay attention that we do not flex our spine. That's a no-no. No flexion, no bending forward in your spine. We do want that movement to be down lower where the legs attach to the body and the hip joint, and that's right where the legs attach to the pelvis. So getting this awareness of this forward and backward movement, feel how the weight moves on your sits bones, the bones you're sitting on when you go forward and back. So let's come down onto the ground, do a little bit more to warm up our hips. So I'd like you to walk your feet back, hold on to your legs and take your elbows. So I'm like this, the elbows are out to the side so I don't want you to have your elbows down here. Have your elbows out to the side as you come down. And then you're gonna activate your core and your pelvic floor. So the pelvic floor is the base of your body. Imagine the very center of your body, you're grabbing towards center to hold on to a blueberry. And then you zipper up. Imagine you're zippering up a tight pair of jeans. If you had to zipper up a tight pair of jeans, you would have to suck your tummy away from the jeans. So imagine you're zippering up from the very bottom of your pelvic area. You could walk your feet back with you as you go back. Zipper, 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 zipper. You could hold on, zipper, 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 and then bring yourself all the way down. So the zippering action can actually help get that core activation that's important, starting at the base where the pelvic floor is, moving on up the core. Come down onto the ground, put the blanket underneath your head, and then let's do some hip warm-ups. So I'd like you to take your feet almost mat distance and align the sides of your pinky toe edges of your feet to the mat. So align them to where the sides of the mat is. Keep the soles of the feet on the floor and let your kneecaps go side to side, side to side. Keep the soles of the feet on the floor. So you're gonna have a limitation here in the movement. If you'd like to close your eyes, you could close your eyes. We are warming up the internal and the external hip rotators, moving the femur bone side to side. Keep the pelvis on the floor. The movement is in the legs only. Side to side, soles of the feet are staying on the floor. You can take your arms out to the side, elbows bent. This will help to keep your rib cage on the ground and keep your pelvis on the ground. Now you could go a little farther, letting the soles of the feet rock towards the edges of the pinky toe or the big toe edge. As you move side to side, your pelvis is going to tilt a little. So you might feel a little bit more stretch in the pelvis, and you may feel some stretching in the low back. So be aware here, is this a safe body movement for you? So depending on what issues you have in your body, if you have low back issues, it may be good, it may not. Really depends on your body and what's going on in your body. Side to side, soles of the feet are rocking off the floor. You're gonna feel a deeper stretch. You may feel the stretch coming into the front of the hip, all the way up towards the obliques, which are the rotational trunk muscles. Getting very familiar with your body. You could also hold on to underneath your mat at the top of your mat. And that will allow you to let the weight of your legs go a little farther. The farther the legs go, the more the buttock comes off the ground, and you feel that stretch in the hip, and you start to feel it up into the midsection. Side to side. And then bring yourself back to neutral. Let's go a little wider here. So now you take the legs off the mat. You can point the toes out towards the side, and then let your knees go to one side, let your head go to the opposite side. That's your inhale. As you exhale, zipper up as if you're zippering up a tight pair of jeans, activating your core to bring your legs back up to neutral. Inhale, let your legs go in the other direction. head goes opposite of the knees. Exhale, zipper up as if you're zippering up a tight pair of jeans to come back up to neutral. Inhale, opposite direction, head goes opposite of knees, zipper up to come back to neutral. Inhale, opposite direction. Zipper up, back to neutral. Inhale and exhale. So this is a windshield wiper. It's one of my favorite movements. You're rolling your hip around in the socket. It's stretching the muscles, ligaments, tendons, soft tissue of that joint. It's also creating synovial fluid, which is a lubricating fluid for the hip. So before we do the practice of moving or doing postures, it's nice to get some fluid movement in your hips, to get a warm up, to bring blood there, to stretch muscles and tissues to keep you safe. Bring yourself back to center. Walk your feet back. Bring your hands on your belly. Take a break between movements. Let's go on to a passive hip joint movement. Take your hand, bring your knee up, and take hold of your kneecap from right above. So your arms stay straight. You're not going to the outside and holding onto the side. You're holding on straight above. And once you take hold of that knee with your hand, let the movement in your legs go. Let your leg go. Let the muscles of the leg turn off, and let the hand or the arm do the work. Do the same thing with the other one. Bring it up, hold on, and let go of the muscles of the legs. You'll feel that. You'll feel that your hands have to turn on here. So let's warm up our hip. Draw your knees into your chest. Draw your knees away from each other. Push them away from you, and then bring them together. Bring them towards your chest. Away from you, and together. In, apart, away, together. In, apart, away, together. Turn this into a circular pattern. You're going to feel the rocking of your pelvis, which is going to start to warm up the lower back, muscles, and spine. And you are moving that hip around in the socket. Let's change positions. Take your legs straight away from you. Then take them apart, bring them towards your shoulders, bring the legs together, and push them away. Apart, towards your shoulders, together, and away. And turn this into a circular pattern. Lubricating that hip, warming up that hip. One more circle. And then bring your feet onto the ground. Bring your hands onto your belly. Close your eyes. So let's take the legs and warm up the legs. Draw the knees in. Now when you draw your knees in, your core has to activate here. So make sure this feels okay for your belly by zippering up. Make sure it feels okay for your low back by zipper up like a tight pair of jeans. If you ever wore tight jeans and you're to lay in the bed and suck in your tummy away from the zipper, that is the action of drawing in and back, and the action of coming from the pelvic floor on up. So let's take the legs and bend and unbend the legs. Now, if you put your hands down alongside your body and you push your legs coming right out of your pelvis, that's going to be the most work. If you flex your feet, pull your toes towards you, reach through your heel when you're reaching up towards the sky. I want you to look at your feet. Do your feet come up? Do they go out to the side like a duck? Or do your toes go straight back towards a wall behind you? Lubricating the knee joint, deeply setting the hip in the pelvis, and stretching the muscles that mobilize the hips and the knees. The quads are getting involved here. They're contracting and lengthening, as are the hamstring muscles behind your legs. And then go ahead and draw your knees into your chest, rocking side to side. And then bring your feet onto the ground. Hands onto your belly, close your eyes, check in, catch your breath. So we're going to come into leg stretching the muscles that mobilize the hip, that are attached to the pelvis, that are really important. We make these limber for fall and fracture prevention, and that we make them limber so that they're very responsive if you do slip, trip, stumble, or fall, that you fall better, or maybe you don't fall because you have that range of motion in your muscles. So for this, we're gonna need a strap. So go ahead and get a strap. So draw the right knee in and try to place the strap on the arch of the right foot. So I don't want you to try to, sorry. So don't try to lasso your foot. I want you to bring your foot in as much as you can. And if you need to do that, do that. But trying to maintain that flexion in your knee and the flexion in your hip. These are bending your joints. So put the strap on the right arch, do the right foot, and then I want you to hold on to the strap. The left hand holds the left strap and the right hand holds the right strap. You could keep the left leg bent or you could straighten the left leg. So see what feels appropriate for you. Take your hands up the strap so your arms are straight. Don't hold your arms down here and bend your elbows. Walk your hands up the strap. We're going to strengthen our wrists and our hands at the same time as stretching the leg muscles. Take your hands high and then wrap your hands around. Now pull on the strap so you deeply root that hip joint in the socket, and you'll feel the center of the buttocks really pressing into the ground. Activate that right leg. Try to keep the right leg straight. So if you can't keep the right leg straight, coming straight out of your body, you may want to move the leg away from you. Do whatever you need to do to get as straight as you can. Push that leg away from you and let's enter this posture. Push the leg away, push the right tushy cheek into the ground, and now pull the leg back. Don't let your pelvis tilt back. Keep your pelvis in a neutral position, which means the low back will not be flattening towards the ground. Push the right leg away, pull down with the strap, push away and pull back with that leg. Deep breaths here. You want to be as long as you could be on your right waist. So this is the right leg you're stretching. You want to be nice and lengthened on your right waist. Your low back is not touching the floor. You're in a neutral pelvic position. Push that right leg away and pull back. Create opposing force and feel that strong stretch at the back of your right leg. Pushing away and pulling back. Take one more breath. And then go ahead and release, bending the left leg if it's straight. Take the strap off the right. Unwrap your hands. Notice that there's a lot of tension in the hands here. You're pulling down, pulling back, keeping those hands nice and strong. And then let's do the left leg. Draw the left leg in, put the strap on the left leg. Straighten the right leg if that's appropriate for your body, or you could keep that knee bent. And then walk your hands up. So get your hands to go straight so that your elbows are not bent. And then wrap your hands around, strap. Pull the leg down to root it down into the ground. You'll feel that strong center buttock pressing into the ground. And then push that left leg away from you and pull back towards the wall behind you. Feeling that strong tension at the back of the left leg. The low back is not pressing into the ground. So make sure you don't feel low back pressing into the ground. You are pressing the leg away or pushing the leg away and pulling it back, creating as much tension as possible. Pull down to feel the pressure of the back of the left buttock into the floor. And deep breaths. Pull the toes towards you, heel up towards the sky. Breathe. Don't hold your breath here. Push the leg away, pull back. Take one more breath. And then bend the right leg if it's straight, and then take the strap off. Put the strap to the side, bend your knees, put your hands on your belly, catch your breath. So let's stretch the adductors. These are the inner thigh muscles. So let's go to the right leg first. So take your strap in your right arch. Left leg straight if you can. If you need to keep the left leg bent, you can. And then take hold of the strap in the right hand and slide your hand down the strap so that the elbow goes out to the sides. Keep your leg really high. So when we go out to the side on this one, when you go out to the side with this, you want to keep your leg up high. And then as you lengthen out to the side, keep your leg up high the whole time. Don't let your leg go down towards your foot. The goal is not to get on the floor. The goal is to keep this inner thigh as far away as possible from this top thigh here. So lengthen that right leg out to the side. Keep your hand on your left pelvis. Keep your left buttock on the floor, left pelvis on the floor as you lengthen the right leg out to the side. So here I'm showing you that I have a wall here because depending on where you are in your practice, if you need to have the support of a chair or a wall, it can be really helpful to focus more on lengthening the adductor muscle as opposed to struggling to hold the weight of your leg in space. You could also put a bolster or a block underneath your leg to support the weight, depending on your range of motion. The goal is to have your leg to the side and as high as possible, having this inner thigh far away from the top thigh of the other leg. Hand on the pelvis to help keep that hip nice and stable, not letting the left leg fly off the ground. Push the left leg into the floor, the left tushy into the floor. Zipper up to activate your core muscles. Let's take one more breath. And then bring yourself back up to center. We're gonna switch coming to the other leg. So take the strap off, bend the opposite. So now we're moving to the left leg. Take your strap on the left foot. And then hold on to the strap with your left hand. Slide your hand out to the side, elbow out to the side. Straighten the right leg. Take the hand on the right hip. Keep that left leg long and lengthen that left leg, keeping it high out to the side. You could put a block under it to manage the weight if you need. Being near a wall can be helpful. Having a chair can be helpful. Keeping that left inner thigh far away from the right top thigh. And then keep that right buttock pressing into the floor, stabilizing your pelvis. Breathing down to your belly. And feel that stretch on the inner thigh. Deep breaths to your belly here. Take one more breath. And then bring that leg back up to neutral. Bending both knees, take the strap off. Put the strap to the side, hands on the belly, catch your breath. So we have the strap here. I'd like to do the bridge posture. Bridge posture is one of the most beneficial postures for healthy aging. When we do this for yoga for bone health, yoga therapy for bone health, what we want to focus on is bending our spine as much as possible because we want to push the back of the spine into itself and create this force in the bones at the back of the body. We also want to strengthen the back muscles because these are the muscles of posture and of alignment that will help with fall and fracture prevention. This is also how we keep our back strong, our spine strong. So this is for your spine. Taking a strap can help you get higher, lift your pelvis a little higher. We activate the side body muscles to help us. So we get a higher lift of the pelvis, which allows for more bend in the spine. So take your strap and make a loop in your strap. If you don't have a strap, you could use a towel and wrap a towel around, or many people have those bands, especially it seems as we get along in this life, we may have potentially visited a PT once or twice and they give exercise bands, or maybe you have one at your house. I do recommend more of a static strap when you're doing yoga, something that doesn't stretch. So having something is a really great for creating extra tension and resistance, so we could work on creating stronger muscles and therefore stronger bones. So you're going to need your head to not be supported when you do the bridge pose. When you do lift your pelvis up and you bend your spine, you don't want to put any extra pressure in your head or neck area. So take the blanket away from the back of your head. And then get your strap and draw your knees in and put your feet through the strap, and then bring the strap right above your knees and have about a fist distance between your knees. Then you put your feet on the floor and you walk your feet as close to your body as you can get them. Take your arms and push your upper arm bones into the ground right alongside your body, so that as you push down, you lift your rib cage up, slide your shoulder blades towards each other. Lift your head, lengthen your neck. So feel the weight in the neck closer to the base of the neck here. And then the feet are closer to your body. Push out on the strap, tilt your pelvis back, inhale. As you exhale, I want you to push your feet into the floor, squeeze your buttocks, push your pelvis up towards the sky. Push your arms into the ground to lift your pelvis up, bending the spine, and then inhale slowly to lower, warming up your spine, warming up the muscles of your back. Close your eyes, feel yourself doing this posture. Exhale, push your feet into the floor, push out on the strap, squeeze your buttocks, push up your pelvis up towards the sky, push your arms into the floor, body up toward your pelvis up towards the sky. Bring yourself down, warming up. On this next one, we're going to come up and we're going to hold. Exhale, push your feet in, push out on the strap, push your arms into the floor, and push your pelvis up towards the sky. Push out on the strap, lengthen your knees away from you. Really push your arms into the floor so that you lift your rib cage away from the floor. You push it away from the floor and you bend your rib cage as much as possible. The weight is water falling to the upper back, the upper torso, not into your head and neck. Push out on the strap, squeeze your buttocks, push your tushy up towards the sky, push your arms into the ground. Really push away from the floor and feel that pushing action as you push away from the floor. Feel how that feels in your body. Deep breaths, keep your mouth closed, breathe in and out through your nose. Push out on the strap, push away from the floor with your feet, push your pelvis up towards the sky, push your arms into the floor. Feel that strength in the back of your body. Take one more breath. We're going to come down slow, so start to move towards the ground and lift your heels off the floor. When you lift your heels off the floor, tuck your pelvis or tilt your pelvis back as you push the spine towards the ground. Try to get the rib cage to touch the floor before the pelvis does. And then let your pelvis touch the ground. Once your pelvis is on the ground, reach back at your blanket, put it underneath your head. Draw your knees in and take your strap off and bring your strap off to the side. Feet on the floor, let your feet be a little wider than your body, knees touch each other, hands on your belly, catch your breath, close your eyes. Just check in with your body, how it feels. And then draw the knees in one at a time. Really wide, so your knees are as wide as your shoulders here as you rock side to side. And then bring yourself onto your side. Protecting your spine here, protecting your low back here. You don't want to lead with your head when you get up. You really want to push away from the floor like a push-up, like a side push-up to push yourself up from the floor. So strengthening the chest, strengthening the shoulders. So take that upper leg, draw the upper leg in, looking down towards the floor, take an inhale. And as you exhale, kick that leg away and push strongly with your elbow and your hand to bring yourself up off the floor. That's going to help keep your spine safe as you move from being on the ground to a seated position. So let's move on. Take your strap off to the side. Bring your blanket onto the mat. And I'd like you to have a bolster or rolled up towels or pillows, especially harder pillows, like pillows from a sofa, for this next movement we're going to do. So get whatever it is you need. So one of the things that is really, really important is that we learn how to bend in our hip joint. And teaching since 2010, thousands of people I've observed. And what happens is we don't realize we need to move at our hip joint. And when we don't move at our hip joint, if we reach down forward, which we're doing all day, every day in the daily activities of life, we start to bend our spine when we bend forward. So the spine bends, which is an unsafe movement pattern in the body. And especially for osteoporosis, because this is where all the fractures occur. And part of that is the way we stand or the way we sit in terms of posture. It's also the way we move. And if we move from our spine, flexing our spine instead of our hip joint, that's unsafe. So I'd like you to put your bolster or your pillows, whatever you have in front of you. And your knee stance is a little bit wide. So have your knees wider than being directly underneath your hips here. So have your knees a little wider. Take your hands on your waist, push your elbows back. And I want you to push your tushy back. Keep your head lifted. That's another important part of this, is to keep your head lifted. Don't look down as you do this, because you're going to start to, if your head goes down, you start to round the upper spine and put pressure on the front of your spine. So keep your head up. And I want you to notice, how smooth is your hip joint when you do this? What does this feel like for you? You're actually lengthening your glute muscles. So you may feel this in your glutes. If you keep your elbows back, you're going to protect your spine, so your spine will not round. And practicing this here on your mat, you then take it off the mat into your daily movements, raising your awareness on how are you moving throughout the day in your body. Very important for bone health. And then if you do other exercises, making sure if you're doing, whenever you do exercises for bone health, that you move safely in your hips. Now bring your knees closer together so they're right underneath your pelvis. Take your arms down alongside your body, palms out. Let's inhale to bring the arms up. And as you exhale, you're going to bring your arms out to the side, bending your elbows, push your tushy back, bending forward, head raised, and then start to turn the hands. So the backs of the hands come onto your back and you bring your forehead down to the bolster. You could also have a block here and stack a block. Now here's the hard part. Zipper up your core, activate your core, lift your head, and then lift your body. Go slow. Slower is harder. More opportunity to develop strength in the back and in the hips, and creating this safe, functional pattern, learning. You exhale to bend forward, bending in your hip, not your spine. You inhale, head first, arms out to the side, and bring yourself up. Exhale forward. Inhale up. Exhale down, tushy back. And bring yourself up.
So that movement can look like it's really easy, but there's a lot of back extensor muscles. The muscles along the back that start in the sacrum and the pelvis, go up the spine to the back of the head. Those are critical muscles for bone health. That's how we load down safely. Those muscles are activated. So that's going to strengthen those muscles in the back body that are necessary to get us to bend properly in our hip joint. So practice that often, making sure you bend in your hip and not in your spine. And notice that when you're moving, because I could reach down and get something off the bolster, maybe even off the floor, keeping my hips relatively straight versus spine straight, bending my hip to lower down. So practice that, because safe hip joint movement is critical when it comes to bone health. All right, let's move on. So take the bolster off to the side. So keeping the front of our hips and our pelvis strong is important. We're going to do a posture called plank. Plank actually targets many of the muscles, especially in the front of the body. So I'll give you a couple of options. You will, depending on where you are in terms of your strength, in terms of your knowledge of the practice of yoga, you do whatever you need to do. And this is going to strengthen our wrists, our hands, our upper body, our posture muscles, our chest muscles, our core muscles, our leg muscles. So get a blanket or something underneath your knees, depending on whatever it is you need. And then take your knees back to the back part of the blanket and bring your hands onto the ground. Take one foot back, bend all the toes and press through the heel. Feel that back calf area stretch. Keep your head lifted here. Now it's an opportunity to strengthen posture muscles when your head is lifted. Don't let your head hang. Switch legs. All the toes, bending the toes, pushing back through the heel. The other foot. And then the other foot. One more. Bring yourself up. So that was a little warm up to get the wrists ready to be weight bearing. We don't weight bear on our wrists often. So doing this is important for keeping our wrists nice and healthy. And then bring yourself down. So your choice, if you want to do a full plank, you can do a full plank, which means the knees are going to be off. Let me give a modification here. Take your hands forward, keep your knees where they are, but bring your hands forward so your body weight goes forward, your pelvis comes forward. You can stay here, zippering up a tight pair of jeans, trying to push the low back up towards the sky. Pelvis forward, you have to manage this, so this is core work here. Or flip your toes under if you're going to do the full plank. And then push through the heels, bending all the toes, push all the fingers into the floor. Now and keep your head lifted, make sure you're not hanging with your head here. So we're going to do a 3-legged plank if that's available to you. Walk your feet so that they're only a few inches apart. Push back and lift one leg off the floor. If you'd like to do the 3-legged plank, it's your choice. Yes, you can, or no, it's not for you. Do what's appropriate for you. And then switch feet. The other foot goes on the ground. Lift the leg up. Put that foot down. Push through your heels. Push away from the floor. Keep your head lifted. Zipper up your core. So feel that zippering up action of the core muscles. Take one more breath. And then go ahead and bring yourself down. Closing your eyes, come to sit. If you can bend your knees, sit in a bent knee position, in a kneeling position. If the knees don't like to bend, sit in a crisscross leg position. Feel the heart rate, keep your mouth closed, breathe in and out through your nose.
One more breath. And then open your eyes. So when you do some of the stronger postures and use more muscles, take a break after you do them to catch your breath. So we're gonna come up and do some standing postures. So let's come up through a squatted position, getting the opportunity here to focus on that proper hip bend coming from the floor. So take your hands wide, take your knees wide, flip your toes under and bring your feet all the way to the edge of the mat. So look back, make sure that this foot is near the edge, and then look to the other side and make sure that that foot is to the edge. And then push your pelvis back so you're bending your hip joint deeply. And then from here, lift your buttocks to the air. Keep your hips bent deeply. So the low belly is coming towards the top thigh. And then your head is looking towards the heel of the hand or the wrist. When you're here, you could push one foot at a time towards the ground, stretching the back of your body, stretching your calves. You can push both down, really bend your hip, make sure it's your hip that's bent. You can put a slight bend in the knees. Take one more breath. And then you're gonna bend your knees a little deeper, keep your head forward as you walk your hands back until your feet touch the floor. And then bring one arm at a time up. Now bring your awareness to your hips. Your hips are bent really deep. Can you let the tushy lower a little bit more and bring the toes off the floor? This is you in the posterior chain in the back of your body. Feel that in your body, head is forward. So strengthening those quadriceps, strengthening those glutes, lower body muscles here. Little deeper if you can. Take one more breath. And then bring yourself up slowly. So let's clear our space. When you bend down to clear your mat, you want to also do that safely. So the bend is in the hips. The weight goes back. Your knees bend also, but most of the bend is in the hips. And your head stays lifted. Don't let your head hang. Bend down, get your blanket, clear your space. And then get a chair. So get a chair and get a block. So let's do a little standing work for the hips. Do a little warm up when you're standing. Now this in and of itself can be good for foot strength, for balance, and for your hips. So you may need a chair to do this. The kneecap, we're going to make circles with the kneecap in the air. So lift your leg up, do circles in the air with one direction and then in the other direction. And then we're going to switch. So if you need the chair to hold on to, you could turn your body around and do that. You could be at the wall to do that. Lift the other knee up and start to do circles in one direction. And then do circles in another direction. And then bring yourself down. So getting the hips nice and warm. Let's take our hands on the back of the chair. Take your feet a little bit away from the chair and you're going to push your body back and up. Keep your head up. You push back into the hip joint. If you keep your legs straight, you're going to feel the pull on the pelvis. You're going to feel the stretch of the glute muscles. So you come forward and you go back. Forward and back. Forward and back. And then bring yourself all the way up. So keeping that awareness that we need to bend our hip and not our spine, really critical to keep that. And then throughout your day, I want you to pay attention to that because there's a lot of things we do. One of the areas that I take the opportunity to focus on that, honestly, is when I go to the bathroom. Because when you go to the bathroom, you're lowering down in your hip joint to sit down. And so I'm very conscious of
Am I equal when I move down, or am I one side versus the other? So as you lower down to go to the bathroom, pay attention to that. You can really pay attention to what's happening in your hip. So let's do a posture that actually we stand on one leg in a forward fold in our hip joint, which is going to create a lot of strength in that hip. It's called Warrior 3. Now the Warrior 3 posture, if done without props, we bend forward in the hip, and then from here you can bring your arms forward. This would be the Warrior 3. We are going to do it with a chair because I'd like to get that alignment in there and get you really weight bearing in the right location in the hip. And it's pretty challenging to get to that position and hold a Warrior 3 if it's something you're not used to, or if balance is an issue. And so doing it with a chair can be a really nice thing to do. So get your block and bring your feet so you're about a foot away from the back of the chair. And then bring your feet so that they are only a few inches apart. So your feet are only a few inches apart. Your big toes are closer together than your heels. So don't be in a duck foot position. Have your toes pointing forward, and your toes are only about an inch apart. The big toes are only an inch apart. And then you are about a foot away from the back of the chair. You're going to push your tushy back, start bringing that bend into the hip joint, and bring your hands onto the chair. You have a block there, but bring your hands onto the chair on both sides at first. Now this may be a lot depending on how much flexibility you have in the back of your legs. You may feel a pretty strong stretch here in the back of your legs. So see how you feel there. Then you're going to take your right hand and put your right hand on the block, left hand on the chair. Take your right foot back, starting with the toes on the floor, pointing down the floor, and lift your right leg up. Now this may be where you stay. You may stay here, or if you'd like, you could try to bring the opposite hand off the floor. So the right leg is lifting, the left arm is lifting. Toes are pointing down towards the ground. Zipper up your core, so feel like you're zippering up, protecting your core. You're standing on your left leg, bending that left hip, really loading in that left hip, creating a lot of tension there. Lift the right leg, squeeze the right buttock to lift that right leg. Keep the toes pointing down to the floor, not out to the side. Left arm is lifted. Push away from the chair or the block with the right hand. Take one more breath. To come out, bend the left knee. Keep your head lifted. Bring your right foot down. Bring yourself up. Come out for a second. That's a lot of work for that single leg balance, front loaded in that hip joint. Warrior 3 is a pretty challenging posture. Let's go to the other side. Toes are forward, 1 inch apart. Start to bend forward in the hip joint, elbows out to the side. Move the block off to the other side. Left hand on the block, right hand on the chair. Take the left leg back, toes are down, and then lift the left leg up. Keep those toes pointing down towards the ground. If you'd like to lift the right arm off, you can lift the right arm off. Zippering up the belly, reach long with the right arm and long with the left leg. Left toes are pointing down towards the ground. Squeeze that left buttock to help lift that left leg. Toes are pointing down. Long right arm. Strengthening the right upper back, strengthening the left lower back, strengthening that right leg that you're standing on, that right hip. Take one more breath. To come out, you bend the right leg a little bit more. Keep your head lifted. Bring your left leg down. Bring yourself out. Bring yourself up. Let's rest in Mountain Tadasana. If closing your eyes is okay, if you have no issues with balance and you're able to close your eyes in the mountain pose, you could do that. Take one more breath. And then bring yourself out. So I'd like to do a balancing half moon posture where we balance on the side of our hip joint. So a few ways you could do this. Having a wall is a really great way to do this. I want to show you, if you don't have a wall, what you could do. So if you don't have the wall for the balancing half moon, you could do this balancing half moon with a chair. I find it to be pretty challenging. This is a lot of balance here. Lifting this leg in the air is going to create a lot of strength here. So this is what we're moving into, is the balancing half moon. So you could do this in the middle of the room if that's okay for you. Doing it near a wall is really a great place to do this posture. You could do it with a chair or the block, because if you have the wall, then you can actually open up more towards the front and really get into that side hip when you're up there to get that force in your hip. So near in the middle of the room if you need, or if you have a wall, I'd like to show you the wall. Doing the block if you have a lot of, if you're limber in your legs, or a chair if you're not. So if you're going to do the chair for the balancing half moon, you may be here. But for those that have enough flexibility to come down a little lower, I'll guide it with the hand on the block. And if you need to do the chair, you do the chair. Pick whatever is the most appropriate for you. That's what matters. So let's do the right foot first. So come to get yourself in a position to do the right foot first. So the right foot faces the block or the chair. And if you're near the wall, you have your body pretty close to the wall. It could start with touching or just an inch away. And then you bend forward in the hip joint to put your hand on the block or the chair. Zipper up your core as you lift the left leg up, and you want the leg to be as high as your torso, an extension of your torso. You want to bring your body forward. Bring your left arm up into the air. You could touch the wall. Now, if you touch the wall, you're taking the balance challenge out of the balancing half moon, which is a good thing to then work on strength and to really get that lift in the leg. When we have too much balance challenge, we might be trying so hard to stay in the balance that we're not able to load deeply or to lift this leg actively. So if you are touching the wall, push the left heel into the wall, push the left fingertips into the wall. Try to see if you can get the left tushy cheek to touch the wall. The right tushy cheek is touching, but try to get the left. So you're rolling onto the side of the right hip capsule area, pressing that femur bone deep into the hip capsule to create stimulation in the bones, to create strength in the hip joint. Take one more breath. And then bend your knee. Bring yourself out. We're going to go to the other side. Lots of strength there on the side of the leg lifting in the air. So switch your props, your chair and your block to come to the other side. So really doing what's appropriate for you is what matters. Staying safe is important. You might need to build yourself up to the stronger variations or the strongest variations. Left foot facing the block, bending in that left hip joint, hand on the chair or on the block, and then lift your right leg up. Lift your legs up. So left arm is on the chair, left arm is on the ground. Oh my goodness. Left arm is up. Right hand, left hand is on the block. Right hand is up in the air. Right leg is lifting. Keep that leg as high as your body. Push that right leg into the wall, turning your body forward, trying to get both buttocks to touch the wall if you can. Deep breaths. Take one more breath. To come out, you bend the standing leg a little. You roll forward in your hip. Don't bend your spine. Bend your knees, bend your hip, bring yourself forward. Keep your head lifted, and then bring yourself up and rest into Tadasana. Deep breaths, keep your mouth closed, breathe in and out through your nose. And then go ahead and relax. So it's time for Shavasana, time for final rest, time to relax your body, clear your space, let everything integrate back into your body. Those are new memories of strength that you just created in your body today during the practice. So go ahead and get whatever you need for Shavasana. I'd like to do legs up the wall because it's a great way to relax the pelvis, to let the leg bones sink really deep into the pelvis and relax the low back, especially if you're having low back issues or you do a stronger practice and you want to really relax the whole hip area and low back area. So I'd like to guide you on how to do legs up the wall. If you come down, make sure you bend your hips and your knees when you lower down, not your spine. Bring your body to the side, so let your buttocks touch the wall. Use your hands to push towards the wall as you bring yourself down, and then roll onto your back. So your legs, your buttock and your pelvis may not touch the wall. It really depends how flexible you are in your legs in order to how close you're going to get. When you're here, you can take your arms out to the side or bring your hands on your belly, whatever you'd like. Stay connected to your breath. Let your body relax. Let your mind relax.
Gently begin to deepen your breath. Start to bring movement into your fingers, your toes. Bring that movement into your legs, into your arms. And draw your knees into your chest. Rock side to side. Come onto your side, and from here, push yourself up to seated. So we'll close the practice with sound. Bring your hands together. Let your hands touch your heart touch your hands, nice and tall. We're going to close with a gentle humming sound on your exhale, just a nice vibrational sound that travels from your heart to your throat. Take an exhale to create space. Inhale deeply. Bring your hands up to your forehead, bowing in the hip joint to bring yourself forward in gratitude. Namaste. All right, so how was that? Definitely some stronger postures. So lots of awareness on bending at the hip, yet definitely some stronger postures. I'd say Warrior 3 is one of the more challenging postures, and so is balancing half moon. So for those of you that are here, let me see. Okay, I'm seeing that now, Sue, if you're still here. I didn't see that before you said that, so I wonder how this practice was for you. Clicking in the shoulders. Yeah, so when we feel clicking in our joints, it could be, malalignment. It could be we have issues in our tissues. If you have clicking that's not painful, or if you have, it sounds like crunchy or crackly, that's crepitus in the joints. If it doesn't hurt, it's the protective tissue that's laid down. It's like cobwebs. So if you're still here, I'd love to know how that was for you. Janice Robinson. I don't think you've been here before, but nice to meet you. Great. Nice to have you here. Hi, Usha. I remember you. Great. Oh, you're seeing Nick Birch. Have you seen him before? I know that I told you to go there and it was going to change your life. I just talked to him this Sunday and I was in a meeting with him on Friday. So I would love to please reach out and let me know what he says. I don't know if you've gone yet, but if you're going to go, I'm so happy. All right. Well, thank you. So nice to see you all. Thanks for all the thumbs up. Subscribe, share with a friend, and I'll see you the next time. Mary, you're there. Wait, I was going to end, but I'm not. He is fully booked. So this is your first time you're going to see him, right? I'm so happy for you. Mary, yay. So glad you're here. Great. Well, hopefully that was good for you. Definitely a little bit of a stronger practice. That's okay. Better late than never, Mary. All right. Thank you. See you all later.